home treatment becomes more often an alternative for treatment in the hospital. Also, Sanquin perceives this for some of its products. To facilitate the transition from hospital to home treatment, Sanquin uses the Sanquin Home Service. Family Verstegen will show you how the Sanquin Home Service works. Mother, son and daughter Verstegen have an antibody deficiency, resulting in an impaired functioning of their immune system. To reduce infections, they regularly receive infusions with antibodies, also called immunoglobulins. Family Verstegen used to go to the hospital for their infusions, but nowadays the infusions can take place at home. Why did they start with home treatment?
We have started with home treatment because the children miss too many classes at school. At home we feel less ill and it is a safe place for us. Furthermore, we no longer are dependent on hospital hours. And of course, we don't have to travel to the hospital. Those were the reasons really for us to start with home treatment.
Switching from hospital treatment to home treatment can take place after consultation with a physician. What are the considerations of the physician to offer home treatment to patients?
For a physician, it's not only important to treat a patient adequately for his disease, but also to take care of a good quality of life for the patient. And that can be enhanced by home treatment. Therefore, it is an interesting option for the physician to consider. On the other hand, it's also beneficial for the hospital to allocate the capacity in the hospital for patients who can't be treated at home and therefore need to be in the hospital. So for both parties, the transition from hospital to home treatment may have clear advantages.
Which patients can be considered for home treatment? Patients who can be considered for the infusion of immunoglobulins at home are those patients who need recurrent treatment. Both the physician and the patient need to have the wish for home treatment. The physician determines whether the patient is eligible.
Patients who are eligible for home treatment need to be stable on their medication, need to be able to tolerate the treatment, suffer no serious side effects, and wish to switch to home treatment. For intravenous infusion of immunoglobulins, it is also important that the blood vessels are easily accessible. This is not necessary for subcutaneous infusion of immunoglobulins.
How does it work?
For the Sanquin Home Service, we use a step-by-step plan. Due to this plan, the transition from hospital to home treatment can take place in a safe way. The plan describes the responsibilities of the people involved and the steps needed to be taken for the transition to home treatment. For instance, criteria for the selection of patients, the application procedure needed for reimbursement, the policy in case of side effects at home, and the agreements with regard to logistics and reporting.
In cooperation with the physician, the Sanquin Home Service applies for approval of home treatment. As soon as the healthcare insurance of the patient has given its approval, home treatment can be started. The Sanquin Home Service works together with Red Swan, a national organization with experience in the deliverance of medication to patients and offering the assistance of nurses for the recurrent treatments at home. The medication for home treatment is delivered to the patient at home at a point of time that is the most convenient for the patient. Intravenous infusions of immunoglobulins are administered by a nurse, usually once every 3 to 4 weeks. To increase the independence of the patient, the nurse and patient consider step by step which actions can be performed by the patient.
In the case of my daughter Bibian, we set out the medication and the other necessities for the intravenous infusion of immunoglobulins. When the nurse comes, she only has to inject the needle into the vessel, and then the nurse leaves. Administration of the immunoglobulins, checking and uncoupling of the infusion are all done by ourselves.
A patient can also choose for subcutaneous administration of immunoglobulins, taking place once or twice a week.
In Wouter's case, we administer the immunoglobulins entirely ourselves. There is no need for a nurse. Wouter prepares the medication and the pump needed for the subcutaneous infusion. I only have to apply the needle subcutaneously. Wouter couples and uncouples the pump without me being present.
After instructions in the presence of a nurse, most patients can learn in a short time how to prepare an infusion and administer the immunoglobulin subcutaneously to themselves. After a while, the patient no longer depends on the assistance of a nurse. This increases the independence of the patient. Another advantage of the Sanquin home service is that the IgG levels can be measured at home. Especially when a patient is treated at home, it is convenient that an extra ride to the hospital is not required. By means of a puncture in the finger, blood is collected from the patient. A finger punction is less stressful for the patient than a venipunction. The collection is performed at home, directly preceding the infusion of immunoglobulins. The measurements are performed in Amsterdam at a laboratory of Sanquin. The form with the result for the IgG level is sent to the physician. With the home service, Sanquin offers physicians and patients who are treated with immunoglobulins the possibility to switch from hospital to home treatment while the quality of care is secured.